beauty coach, Dr. Ann-Therese Stubbs, is constantly looking for new and trusted treatments to help us all feel beautiful. Of course, she wouldn't use anything she doesn't believe in, which is why it is easy to see her excitement over a new procedure known as Thermi-Smooth. And Dr. Ann, these results are pretty incredible.
They're amazing. It's just, it kind of heats the skin and shrink wraps it.
I like how you put that. So tell us kind of how it works and what it's doing for people.
Well, basically, Thermi is a radio frequency energy, so it's a heat that's applied to the skin, so it's not a laser, and it's not going to ablate or peel the skin. It's just a warm electrode against the skin, and we rub that back and forth until the skin gets up to about 43 to 45 degrees centigrade, and that's the magic number. So if you can keep the skin around 43 to 45 for about 15 minutes, it sends all our little cells that make collagen into high building mode, and the collagen builds over the next few weeks and the skin tightens.
How is this a good treatment for the eyes?
Well, eyes are an area that after a certain age, people tend to think age them. They say, oh, I look tired, I have these crinkles, and you can see this lady on the top here, that's her before picture, and after 4 treatments, just with some heat around the eyes, smoothing of all those little crepey little lines around the eyes. Those are areas that we can't fill with fillers. You know, some of the neuromodulators like Botox and Dysport don't do too much. We can't put them that close to the eyes safely. So this is an area where we can put the heat around there. No goggles required or anything. People come in 15 minutes on each eye. It's just the warm feeling. You're a little pink afterwards, put makeup right on and go, or sunblock on and just go. No downtime, and very comfortable.
And that was the thing is that we saw with 4 treatments, but are you seeing results after the first and then they just keep getting better?
You do. In fact, right when you're done with the treatment, all the erythema or just a little bit of redness and plumpness from the heat itself is visible. And so people sometimes feel like they look great right after treatment because all those little lines are plumped out. Over the next few weeks, the collagen builds and makes that a reality.
Let's look at some other before and after.
I think those tell the story, definitely.
Exactly. So this woman, I mean, it takes years off.
It does, and this is an area where, as I said, those crinkles around the eyes, they develop because that skin is thinner. You know, sometimes we've pulled on it with eye makeup through the years, or maybe even just contact lens wearing. And that's an area that's very thin skin, so it tends to wear quickly. Sun damage too shows in the eyes, so the crinkles. So this is a before and after. You can see all those little crepey lines are gone, and it builds some volume there too. This gal too, just a little bit of an eyebrow lift. The interesting thing too, they've just come across with this technology. It was developed for tightening skin, but around the eyes, they've found that it starts to rebuild the glands that promote the tears. So people with dry eyes who've years been on medicine are now finding that after 1 or 2 treatments, their own tear-producing glands have gone back into function, and they're getting rid of their dry eye syndrome.
So that's a really good benefit.
It's a huge sidebar, but they're going for their FDA approval for dry eyes right now too.
Oh, that's incredible.
So we're using this excitingly to get rid of the wrinkles and the crow's feet and give a little brow lift and all. But for people with dry eyes, it's a wonderful, wonderful treatment too, because they can lose their eye drops or whatever medication they're on for their tears.
And how long are these results lasting?
Well, we are seeing, you know, it's a very new technology. It's been out about 2 years, and we're seeing results last, you know, about a year, and then people get a maintenance treatment to kind of rebuild that collagen again. And I like to tell people that, you know, you don't go to the gym once and that doesn't suffice for life. The aging clock still does continue, so we're still losing collagen. You have to have good sunblock, a good Retin-A eye cream is always good too to maintain the results. But it's very comfortable, very affordable, and kind of quick and easy with no downtime. So women and men alike are loving this.
And aside from the eyes, it can help with other areas of the face, right?
Oh, it can. We do whole faces. If somebody's worried about the crepey skin or some jowling here, we can do that. We have all areas of the face that we treat, and we've kind of expanded it to the body as well. So we'll, in further segments this month, show you some pictures from other areas of the body too.
Okay, Dr. Ann, you always have a special offer then to get our daytime viewers started.
Right. We always do a complimentary consultation because we want to make sure this technology is the right one for you. So we always do a consultation first and go through a medical history, and then we're offering your daytime viewers 20% off the series of 4 treatments.
Okay, Dr. Ann, as always, thank you so much.
Thanks for having me.